Hey everyone, today we're going to go over how to do some soft tissue release work on a muscle that's common for shoulder as well as neck pain. It's called your levator scapula, and it actually attaches on the inside top border of your shoulder blade and then runs all the way up to the base of the skull. It's often common for people to complain of pain kind of radiating right in the middle between their two shoulder blades, or headache type symptoms all the way up to the base of the skull, and it often is really painful with any neck movement as well as overhead movement. So what do you need to do? You need a foam roller. Doesn't need to be a long one, but it needs to be something that allows you to prop your hips up and be supported, which I'll demonstrate soon. And then also your homemade foam roller, which is just the two lacrosse ball combination. This is going to go right at the base of your neck, right on the inside of where that muscle attaches onto the shoulder blade. So I'm going to show you here as I turn. It's going to be right in this little area, and you're going to place your homemade roller right there. You're going to see me do that here lying on my back, and then you're going to need the foam roller here. Place it right under your knees to begin. You're going to lie down on your back, anchor that lacrosse ball right underneath, and then you're going to bridge your hips up. Place your hips right on top of the foam roller so the rest of your body can relax. And now the angle that your body is at allows for increased pressure in a good way to be placed where we're trying to do our myofascial release work. Now, if you're feeling enough tension right here already and it's in the right spot for you, go ahead and kind of just let your body melt into it to release that tension. If you need to readjust, a couple of suggestions that I give are feel free maybe to move side to side. Maybe the lacrosse ball needs to be closer to your spine. Maybe it needs to be moved further out. Another option is also to move the lacrosse balls up a bit, closer towards the top border of that shoulder blade, or perhaps you need to move it down a little bit. So kind of find where that soft tissue is talking to you the most, and that's where you want to stay. And then from there, another option is to take your arm now, and you're going to reach it across your chest towards your opposite hip. And as you do that, you're going to find that there's usually a point or two through that range that is more sensitive than not. And if that is part of the range, or as you're starting, feel free just to hold that arm there, or you can take your other arm and support it if you need, and then continue to pull through that range. Okay? So moving through that area. Sometimes I recommend taking the arm just across to the opposite shoulder, then coming across opposite side, halfway down the rib cage, and then moving all the way towards the opposite hip. So again, find where your body is telling you that you need it the most, and kind of work through those areas as much as you need. Okay? And then after that, to come out of the position, I recommend taking your small foam roller out first, then lift the hips up, roll the foam roller out so that you can rest the hips gently back down onto the mat.